The Lancet Oncology Commission report says Nigeria lost about $5.9 billion to cancer deaths and other cancer-related factors in 2019. The chairman, Lancet Oncology Commission for Sub-Saharan Africa, Professor Will Ngwa, said this in Abuja at the public presentation of the report titled Lancet Oncology Commission, Cancer in Sub-Saharan Africa. While presenting the highlights of the report, he said that cancer was greatly impacting economies in the region, with Algeria losing $2.6 billion, Angola $1.2 billion, Benin $209.2 million, Botswana $500.6 million, and Burkina Faso $270.6 million to the disease.
COVID-19 is an infectious disease, so it always means that there's, when it's happening, I can tell you, people don't want to pay more attention to it because it can travel from one capital to the next quickly, right? But, we need to realize that cancer is killing more people, like you said, and so we need to dedicate that same priority as we are doing for COVID. So actually, we are saying Africa needs to call a cancer conference. They have to call a cancer conference. So actually part of the process we're doing now is to really elevate cancer as one of the big things that should be talked about.
Former Minister of Health, Professor Isaac Adewale, said that there were various interventions by the federal government to reduce the burden of the disease in Nigeria. He, however, said that what was most important was political action and not just political will.
National Health Insurance Authority offers health insurance to all Nigerians. Not only that, cancer screening is one of the key deliverables in that document. And so Nigeria actually is likely to become the first country in Africa where cancer screening will be covered by health insurance. So things are moving on, but we need to really scale it up because we have over 200 million people. We need to improve on access. We need to improve on care. We also need to take care of the funding.
The editor-in-chief, Lancet Oncology Commission, Professor David Collingridge, said that the constant long-suffering and mortality driven by infectious diseases, malnutrition, and poor maternal and child health in Africa was now being affected by the growing incidence of cancer and other non-communicable diseases.
This report really shines a light that here in Nigeria, for example, universal health care, access to cancer registries, better prevention are all absolutely essential in our battle against cancer. Just in 2019, Nigeria lost $5.9 billion through deaths to cancer. That is a huge impact on society. That loss of human life is a tragedy. And we need to put the processes in place now to make sure that Nigeria maintains its place as a prosperous nation, a healthy nation, and supports the future generations.
We're advising women to do more of self-breast examination, be breast aware, be able to understand and identify the various lumpiness in your breast, so that if you pick up something unusual, that is an indication for you to get yourself to the hospital and get screened. We have early detection strategies that we are promoting now, which include clinical breast exams, which are done at the health centers.
The News Agency of Nigeria reports that the commission was created to inquire into, describe, and analyze the state of cancer and recommend key actions to address the growing challenge.